I'd never heard about it before. I'm a registered nurse. I've worked in the intensive care unit for 28 years, and I've been doing dialysis now for probably about 20 years. The surgery I had was a left total knee replacement. I actually had an injury to my knee when I turned 40. So for 15 years, I've had issues with my leg. But it's been the last 2 years that I've had a lot of problems with walking and going up and down the steps. And so finally I agreed to have the total knee replacement. It wasn't until the physicians brought it to my attention that, oh no, there is a great chance of getting DVTs after having the surgery. And so that became a big concern of mine. The last thing I wanted to be was on an anticoagulation, especially after having surgery. And then going up and down our steps and stuff, I didn't want any risks of extra bleeding or complications. I didn't want to go the route where I needed to have injections in my stomach or be put on Coumadin. My mother was on Coumadin after her surgery, and she had probably one of the worst nosebleeds I've ever seen from it. So I didn't want to have to go that way. The idea that they had a different avenue that I could do, a choice of treatment, and use this device was probably the best thing for me. So I liked it. To me, wearing the device was so much easier because all I had to do was put the stocking on and wrap the device, and I carried it with me everywhere. It had a nice little shoulder, so it was like wearing a purse. It wasn't inconvenient at all. And even when the grandkids are here and stuff, they would come and look at the motor and look at the picture, and then they were off doing their thing. So it just became part of your normal routine. The 2 weeks that I had to wear it actually went by pretty quickly. So it was not an inconvenience at all. And it was great. I did not have to take any pills. I didn't have to take any shots. I did not have to have any blood work done. I just had to wear the device. The ActiveCare was actually already on. When I woke up in recovery room, it was already on. And the right leg, they had already had it hooked up and was working. The left one was not, that I'm aware of, because I just don't remember it, where I remember the right one squeezing my calf. Then the next day post-op, then I remember feeling the left one. So I had it right away. They were already there. The main benefit of wearing the device is probably the ease of wearing it, in that it takes away all of the complications that you have of receiving any anticoagulation. The idea that I can wear this device and not have to worry about developing blood clots or have any swelling in my lower legs was unbelievable. I did not have to leave here to go anywhere to have somebody check it. It just worked. So I walked in the hospital with the walker and with the device still on, because it just hooked right on top of my walker. So I had no limitations with that at all. In the hospital, I was concerned that it would wake me up, just because of experiences with the patients that I have here in the hospital who don't like the cuffs that they wear. They say it feels like somebody's grabbing their calves. The very first time that I felt it inflate, it made me think of those patients, and that, oh no, this is what's going to be for me. That is the only time I felt it. I went to sleep, never felt it. I wore it everywhere. Now probably for the first month I didn't go outside much, but we did go to dinner a couple of times, and I would just, wear it over my coat, just like wearing a purse, and then when we were sitting down at dinner, I would take it off and just set it on my lap. But I took it with me everywhere. So when you put your pants on, it's all underneath, so they can't see anything. All you're seeing is this little motor that you're carrying, and most people are just oblivious to it. So we went several places with it. I was concerned that I would have limitations in being able to turn and roll. The only limitation I had with that was more with the surgery of the knee. The cuffs never bothered me at all. You just put a pillow between your legs and roll, and you didn't get tangled up in the cords or anything. I would definitely recommend this to any patient, especially if their alternative is having injections or the Coumadin. I've seen so many people come in with complications from their clotting factors being too thin that I would definitely recommend this. Yes, I do think it was very wise for the hospital to be able to use the device. Treatment choice is always a positive, and if you educate patients and let them know that they can have a choice between having a device that's going to prevent DVTs versus having the injections, then I do think it's very wise for the hospitals be informed with this and use this as a treatment choice. Well, first I want to tell you the service I thought was wonderful in the hospital because I did not expect to meet a sales rep. I did not expect them to give me any extra education on it, and I did not expect to see the videos. So as a nursing standpoint, that surprised me, and I was very pleased. So it started in the hospital. When I got home, I did receive a phone call asking if I had any problems and if there were any questions that I had, and I didn't. They continued to give me their phone number so that I could call them if I had any issues. The return of the device was easy. They'd given me everything. All I had to do was put it in, put the label on, and send it. I didn't have to do anything else. Actually, I didn't have to do anything. Bill sent it for me. But it was as easy as can be. And then 2 days later, I received a phone call just checking to see if I did return the device to remind me to return it. So everything was very simple. All the work was done for me, basically. So it was nice. I hope to hear more about this at our local hospital. So that would be really nice.